I want to briefly touch on two things. One is the VEXAS syndrome. This is a recently described entity, and patients with this syndrome who have this classic something called vacuoles in the bone marrow, followed by even enzyme X-linked, means that the mutation they have is X-linked, and they have lot of rheumatologic symptoms like bone pains, joint pains, and they have the somatic mutation in something called UBA1. And almost all the patients with VEXAS syndrome are male. There are very few isolated reported cases of females, but almost all of them are male. And these patients present with low blood counts, and they can also progress to myelodysplastic syndrome. It's a recently described entity. Right now, we are treating these patients as MDS patients and using hypermethylating agents to treat these patients. And if they are eligible, we are taking them to allogeneic stem cell transplant. But there are right now a lot of clinical trials ongoing in developing new drugs for these patients. Lastly, I want to describe about one entity called MDS MPN Overlap Syndrome. As I talked earlier, in myelodysplastic syndrome, majority of the patients present with cytopenias. But MDS MPN Overlap syndromes, sometimes the patient can present with high blood counts as well, and they tend to have symptoms of something called myeloproliferative neoplasms with enlarged spleen, and a lot of constitutional symptoms. This is a rare subtype with no clear treatment defined at this moment right now. And we borrow a lot of treatments from myelodysplastic syndrome as well as myeloproliferative neoplasms. There are right now a lot of dedicated clinical trials to develop new treatments for this entity, which is a huge unmet need in my opinion. So to conclude, I want to highlight few take-home messages. I think one thing is fatigue could indicate low blood counts, and I think that needs to be evaluated. And multiple studies in myelodysplastic syndrome have shown, especially low risk MDS, that low red blood cells can negatively impact the quality of life and activities of daily living, and can also have a decreased survival as well. And other thing which has highlighted earlier, the prevalence of chip, which is almost close to 10% in patients who are more than 70, and that needs to be evaluated, and needs to be monitored very closely, because it not only increases your risk of development of blood cancers, can also put you at risk of cardiovascular disease as well. Another thing is, it is very important to we right now have multiple treatment options for low risk MDS. We have in the past 5 years we have three new treatments for myelodysplastic syndrome in especially in the low risk MDS. I think it is important to be evaluated at a tertiary cancer center for, if you have a high risk MDS. Given the limited treatment options available, I think I highly encourage to participate in clinical trials in high risk MDS. Given the limited treatment options, we need to develop better drugs in that setting. As well as I want to highlight about the transplant consideration. Age should not be the only factor. We need to take both the comorbidities as well as the performance status in determining the transplant candidacy. Thank you so much for listening to my talk. I'm going to hand it over to Andrew.